Hello, everyone, and welcome to the Maitri podcast Between Friends Conversations with Maitri. I am your host, Nandini Ray, and I am thrilled to have you with us today. If you are joining us for the first time, let me share a little bit about Maitri. Maitri, since 1991, Maitri has been dedicated to providing free, confidential, and culturally responsive services to victims and survivors of domestic violence, primarily from the South Asian community. Through this podcast, we aim to raise awareness around domestic violence, gender-based violence, and related issues. Each episode is crafted to offer valuable insights and resources, not just for survivors, but to educate the wider community on the importance of violence prevention. Today, we are especially excited to introduce a new segment called Policy Matters. Every quarter, we will dive deep into key policy issues that are critical to the movement against domestic violence. So stay tuned for our first episode of Policy Matters.
Welcome to Policy Matters, a quarterly presentation from Maitri Policy Advocacy, where we discuss public policies that are at the heart of shaping the way prevention, intervention, and overall awareness impact domestic violence advocacy within our communities. My name is Smitha Chandrasekhar, and I am a senior at the University of Washington studying biology, as well as a member of the Maitri Policy Advocacy team. In our first presentation, we will look at the California mandate requiring medical providers to report suspicions of domestic violence. This has been in the minds of survivors and advocates alike for a long time, and many are seeking to change the law. Joining us for this conversation are Chris Negri, the Associate Director of Public Policy Strategies at the California Partnership to End Domestic Violence, and Anisa Ali, the Program Manager of Health at Futures Without Violence. Let's begin. When a woman named Seema walked into the emergency room one summer night in 2023, she anticipated a few hours of wait and going home to her sleeping family just in time to prepare for another morning routine. The arguments with her husband had been getting intense lately, and this particular night, he pushed her hard on the floor, resulting in a tear in her ankle. She had already spoken with her family about the abuse and was in the process of setting up an intervention through her brother-in-law that week. Unbeknownst to her, it would be a long time before she would speak to her husband again. The California law enacted in 1994 mandated that police be notified about any domestic violence-related injuries medical professionals treat. 30 years later, advocates are still trying to undo the damage mandated reporting can and has caused by trying to limit the kinds of incidents that are legally required to be reported, in addition to other goals. How did this law come to be in the first place? Let's hear from Chris.
The motivation for the 1994 law was really decades of police not treating domestic violence injuries with the seriousness that they merited. And so there was a school of thought, that adding this mandate would allow for more survivors to get the support that they might need, that police involvement, a mandate for medical providers to connect with police would allow for these cases for fewer of them to be ignored and to fall through the cracks and not to be addressed. And so, the origin of the law, I think we would all agree, was well-intentioned. It's really all of the effects and all of the stories and all of the examples of not ideal outcomes stemming from it in the 30 years since then that is motivating us to take another look at it.
Anisa confirms the positive intention behind the law and adds her own thoughts.
Yeah, thanks, Chris. I would also just say that at the time, in the 1990s, we didn't have in California this really wide, robust network of domestic and sexual violence advocacy programs that we now have. And so also at the time, law enforcement was just kind of seen as the solution to domestic violence. So as Chris mentioned, again, really good intentions and thinking about how to support survivors of domestic violence and make sure that it's really recognized as a serious public health issue and giving healthcare providers a role in supporting survivors. But as we can definitely talk about, we have learned a lot since 1994.
What have you been hearing from survivors and advocates regarding this new bill as well as the 1994 mandate?
Yeah, I would say for this bill, with the California Partnership to End Domestic Violence as one of the co-sponsors on this bill, and as as the coalition of a statewide domestic violence programs, we have just heard from so many of the advocacy programs across the state in California how much this law really impacts survivors seeking healthcare. And we hear that over and over and over again. We hear things like survivors are at risk for, they might have an injury on their leg, with their leg, and they delay seeking healthcare so much because of this fear of a report to law enforcement and everything that that might entail. Child welfare can get involved, immigration authorities can get involved. So delaying healthcare so much that their leg is at risk for being amputated, or stories of survivors super gluing their cuts together, or trying to do their own stitches on cuts rather than seeing a doctor. There's a lot of stories of survivors who are foregoing prenatal care, which can, lead to all sorts of labor and delivery complications and birth outcomes because of this bill. And so we're just hearing over and over again that this bill is real, or sorry, this law currently that we have in place is really impacting how survivors are able to seek healthcare. And so, then with the bill that we're proposing, I think what we're hearing that survivors and advocates across the state really appreciate is that it is really centering survivors' needs and centering survivors' autonomy. So, survivors, as we all know, so often their decision-making power is really taken away from them as a result of the abuse that they're experiencing. And that same pattern gets replicated if there is a mandated report to law enforcement. Then it's that same lack of decision-making power that they're experiencing, and a decision is made without their consent. And so what we are trying to do with AB 3127 is put the decision-making back in the hands of survivors. So they're always healthcare providers, if they know or suspect a patient is experiencing any form of domestic or sexual violence, not just physical. So, could be earlier in the cycle of abuse, could be verbal abuse, financial abuse. Providers will be required to make a referral or warm handoff to an advocacy program. And, survivors, if they want to still report to law enforcement, a healthcare provider is still required to do that. Survivors can also work with an advocate and get support as they are wanting to report to law enforcement. So we're really just wanting to make sure that survivors have options, again, instead of this mandated report without their consent. And so what we're hearing is that advocates and survivors across the state really just appreciate, acknowledging really centering survivors' needs and putting the decision-making power back in the hands of survivors, and just making sure we're removing some of those barriers to accessing healthcare.
Awesome. Chris, do you have anything to add?
I think Anisa pretty much captured everything I was going to say. The only thing that I mean, there is an understanding among domestic violence advocates that mandated reporting does not automatically equal survivor safety and well-being. And so, that is what this is about, is putting survivors in the driver's seat, giving them the autonomy to decide when and if they're going to involve law enforcement and when, so that they're not put into a position where they are immediately reported to the police and all of the effects that flow from that immediately happen, whether it's report to Immigration and Customs Enforcement, or report to Child Protective Services, or losing your housing, losing the income that will allow you to sustain yourself and your children. I mean, really what we see beyond some of the really awful stories of folks not seeking healthcare. There's also, the really harrowing, awful stories of folks who are reported to police and they lose their housing, or their children get put into foster care, or they're reported to Immigration and Customs Enforcement and are at risk of deportation. That was not, at the front of anybody's mind in 1994 when this law was passed. Just so happens that these are the effects that have you know, arisen from that. So, that's one of the additional motivating factors for us to reform the system.
And I will also add to that, at the time that this bill was passed, there were many, many advocates in California that immediately were trying to overturn the law because they knew, in their experience working with survivors, that this was going to have harmful consequences. And it's just been a 30-year battle since then. And so we're hoping now with this, we have a very powerful network supporting AB 3127 behind us. So we're hoping now that we can finally make the change that so many advocates have wanted to make for the last 30 years.
Yeah, thank you both for such thoughtful answers. And kind of going off of what you just said, Anisa, it leads very well into our next question, which is how previous efforts to amend this law have not always worked. So what do you think was the challenge at that time, and what do you think is different about this current bill?
I think at that time, as Chris mentioned, and it's still there to a certain extent, but there's this assumption that law enforcement equals safety. And I mean, law enforcement can work for survivors, and it could be a path that survivors want to take, and that's totally fine. It needs to be their choice. And so I think there's just this assumption that is really hard for people to step outside of, that law enforcement equals safety, and the way to address domestic violence is by putting people in jail. And we know just so much more about prevention now, and knowing that, if we really want to prevent domestic violence, we need to really move upstream. And we need to think about preventing violence before it starts, and not intervening when there is, a major health crisis. So I think, folks are starting to see there. It's still, again, still there, but folks are starting to see that in law enforcement maybe doesn't work for everyone, and maybe it can be a solution. As we know, there are disproportionate effects on people of color, survivors of color, and queer and trans survivors. So I think what is shifting is this recognition that there are multiple pathways to safety. And again, that it's hard, I think, for people to see that there could be a different way for a survivor to seek safety and to center their health needs. But I think it is starting to shift.
Right. And another significant difference with this year's bill as opposed to the last two times that we tried this is that this year's bill keeps the mandated report in place for life-threatening injuries. So it's a bit more of a consensus approach. There has been an attempt to really engage with opposition, take in hand their concerns. I mean, if this were to become law, AB 3127, another thing to note is that That would put California in the company of 8 other states, including Ohio, North Carolina, Florida. Um, there is a pretty mixed patchwork if you look nationwide in terms of the way that states address this question of sort of which injuries get automatically reported to law enforcement. California right now, under its current law, is a bit of an outlier. So only 2 states require the level of reporting that we require of really all injuries due to crime, with specific mention of crimes due to sexual assault and domestic violence. I think it's just us, and I want to say North Dakota. Um, so, I mean, in this year's effort, we're trying to situate that within the larger national landscape. And so this bill really is a very moderate approach to this problem.
Yeah, thank you both. So kind of going off on like in this direction about what this current bill is doing, what is the next step for organizations like CBEDV in terms of pushing this bill forward and advocating for it?
As of recording, at least tomorrow, we will find out whether or not the bill got passed out of Senate Appropriations, where it was referred earlier on this summer for their consideration. So tomorrow, August the 15th, is Suspense Day, when the Appropriations Committee will announce decisions on hundreds of bills. If, and we're hopeful that, we pass out of Senate Appropriations, we'll head to the Senate floor, and we'll do advocacy on that, with a view, hopefully, to getting through the Senate and onto the governor's desk. I mean, this has been an effort of 3 years now. So it's an ongoing effort. But hopefully this is the year that it passes into law.
Yeah, that's great. Anisa, do you have anything to add?
Um, no, I think Chris covered it. We're just really anxious and hopeful for tomorrow. It's difficult when we in the last 2 years, the previous iterations of this bill have both died in Senate appropriations. So here we are at this point again. And even with this major concession that we've made this year of still requiring life-threatening injuries to still be reportable to law enforcement. And then, of course, in addition to gunshot wounds, which we have had in there the last couple of years, gunshot wounds are still reportable to law enforcement. And then child and elder abuse statute still stands. So even with that major concession, we, have done our best efforts in reaching legislative offices and have done all our due diligence in figuring out how to get this through. And and when bills die in appropriations, it's difficult because it's hard to know or find out even what the reason is. I mean, ostensibly appropriations is about money and funding, and we don't have a fiscal component really attached to this bill. If anything, it is actually a healthcare savings, because if you are addressing intimate partner violence earlier in the cycles of abuse, and survivors are able to access healthcare without a fear of a mandated report, and they are required to receive a referral or warm handoff to an advocacy program, then that is going to improve their health outcomes immediately and later on in life as well. So that, of course, is a healthcare savings. So it's a little bit hard to know how to get off of appropriations, how to get out of the committee, but we are certainly making our best efforts. So we are hopeful for tomorrow and hoping that this is indeed our year.
Yeah, of course, fingers crossed. Shortly after we recorded this segment, we learned that the aforementioned bill is not moving forward in the California State Legislature. Here is another missed opportunity from our government leaders to be able to improve the safety net for survivors who need medical attention, something that could be achieved by dissuading survivors from avoiding care out of fear of law enforcement involvement. Looking at Seema's situation that I shared earlier, once the police got involved, Seema lost the chance to create an effective intervention and instead was forced to participate in a legal system that did not appreciate the challenges an immigrant with dependent status may have to face in the United States. The proposed law would have allowed Seema to seek help from the police, but only when she was ready and willing, not out of requirement or compulsion. Now, with the same provision still in place, she is back to being unable to make these important decisions regarding her own life. The real question remains, is mandated reporting truly the best way to address domestic violence? We encourage you all to continue to ponder this for now, until the next window opens us to be able to make active change.
Thank you so much, Chris, Anisa, and Smitha, for this insightful discussion. We truly appreciate the time and expertise you have shared with us today. Listeners, thank you for tuning in to the Maitri podcast Between Friends. Please don't forget, you can find all our episodes on Maitri Bay Area's YouTube channel, Spotify, and other podcast platforms. Please like, share, and follow Maitri's podcast and social media pages and spread the word. If there is a specific topic related to the gender-based violence and abuse that you would like us to cover, we would love to hear from you. Please feel free to email us at maitri@maitri.org with your suggestions. And please visit our website, maitri.org. Thanks again for listening. Bye for now. We will catch you in the next episode. Thank you. Maitri is a free, confidential, non-profit organization based in the San Francisco Bay Area that helps families and individuals facing domestic violence. Don't suffer in silence. Call Maitri Helpline 1-888-8-MAITRI. MAITRI. Visit our website, maitri.org.
This show is for informational purposes only and is not to be construed as legal advice. Always consult an attorney for legal advice. Views expressed by guests of the radio show are individual opinions and not endorsed by Maitri.